Hello, friends. I am Dr. Shreyashi Chatterjee, medicine specialist, diabetes and hormone specialist. Today we are going to talk about a problem that many people experience but often ignore: tingling in the hands, numbness in the feet, a pins and needles sensation, or suddenly feeling like your hands or legs have fallen asleep. Many people say, "Doctor, my feet burn at night. I can't properly feel my toes anymore. Sometimes it feels like I'm wearing socks even when I'm barefoot." In today's video, we will discuss why tingling and numbness happen in the hands and feet. What are the most common causes? Which warning signs should never be ignored? And who is more likely to develop this problem? If you enjoy simple and easy to understand medical information, please subscribe to our channel, Dr. Shreyashi Chatterjee. So friends, let's get started. First of all, let's understand why tingling happens in the first place. Our body has a large network of nerves. These nerves carry messages from the brain to different parts of the body. When these nerves do not function properly, or when they are compressed or become damaged, you may feel tingling, numbness, burning, pain, or weakness in the hands and feet. Now let's talk about the most common causes. One of the most common reasons is staying in the same position for too long. This happens to almost everyone. Sometimes we sit cross-legged for a long time, or work at a desk for hours, or sleep with pressure on one arm. Then suddenly, the foot feels numb, or tingling starts in the hand. This usually happens because pressure is placed on a nerve, and blood flow temporarily decreases. The good news is, this type of tingling often improves on its own within a short time. But if tingling keeps happening repeatedly without pressure, it should not be ignored. Another very important cause is diabetes. If blood sugar stays high for a long time, it can slowly damage the nerves. This condition is called diabetic neuropathy. What usually happens in the beginning? Mild tingling in the toes, then burning sensation, then numbness. Some people describe it as feeling like they are wearing invisible socks. Many people with diabetes say, "Doctor, my feet burn more at night." This may be a sign of nerve damage caused by diabetes. And friends, this is extremely important. When the feet become numb, a person may not notice small cuts or injuries, and this can later lead to wounds, infections, or serious foot problems. That is why keeping diabetes under good control is so important. Another common reason is vitamin deficiency, especially vitamin B12 deficiency. This problem is becoming increasingly common nowadays. People who do not eat properly, those doing extreme dieting, people with poor nutrition, or people taking certain acid reflux medications for a long time may develop vitamin B12 deficiency. What symptoms can occur? Tingling in the hands and feet, weakness, fatigue, balance problems while walking. The good news is, if detected early, it can often be treated successfully. Now let's talk about another very common cause: pinched nerves in the neck or lower back. Nowadays, people spend hours using phones and laptops. Constantly bending the neck forward can put pressure on the spine, and the nerves coming out from the neck may get compressed. What can happen then? Tingling in the arms, pain traveling from the shoulder to the fingers, or weakness in the hands. Similarly, when nerves in the lower back get compressed, it can cause tingling, numbness, or electric shock-like sensations in the legs. Now let's discuss some other less common causes, such as thyroid disorders, kidney disease, excess alcohol consumption, side effects of certain medications, or anemia. In some people, stress and anxiety can also trigger tingling sensations in the hands and feet. Now comes the most important question: when should you seek immediate medical attention? If tingling happens along with sudden weakness on one side of the body, facial drooping, difficulty speaking, difficulty walking, or loss of bladder or bowel control, please seek urgent medical care immediately, because sometimes these symptoms may indicate a serious medical condition. And friends, please do not always dismiss tingling as just weakness or poor circulation. Sometimes the body gives us warning signs early. We simply need to pay attention to them. Now, finally, let's discuss a few simple things you can start doing today. Avoid sitting in one position for too long. Move your hands and legs regularly. Keep your blood sugar under control. Eat a healthy and balanced diet. Get checked if you suspect vitamin deficiency. And avoid taking painkillers repeatedly without medical advice. So friends, In today's video, we learned about the most common causes of tingling and numbness in the hands and feet. In Part 2, we will discuss what tests may be needed, how these conditions are treated, and what precautions you should take at home. If you found this video helpful, please like, share, and subscribe to our channel, Dr. Shreyashi Chatterjee. I am Dr. Shreyashi Chatterjee. Thank you.